On Friday, a panel of independent experts advising the Food and Drug Administration voted overwhelmingly against the approval of a booster shot of the Pfizer vaccine for Americans 16 and older. The committee did vote unanimously in favor of boosters for people at higher risk of infection. But the widespread use of boosters had been at the center of the Biden administration's plan to fight COVID-19. So with Pfizer and Moderna reporting the efficacy of their vaccines wanes over time, what happens from here? NBC's Kathy Park has more in our Sunday Focus.
This week, more confusion and controversy over COVID boosters after members of the FDA Advisory Committee rejected Pfizer's boosters for most Americans, instead recommending them for people 65 and older and those at high risk for severe illness.
I think we need to target the boosters right now specifically to the people who are likely to be at high risk.
The meeting happened as a battle over boosters heats up in Washington and beyond. Pfizer made the case for boosters by pointing to data that shows vaccine efficacy wanes after 6 months of being fully vaccinated. The Biden administration has pushed for additional doses to fight the surge of COVID hospitalizations and deaths. He announced a timeline last month for a booster rollout for most adults as soon as Monday.
8 months after your second shot, get a booster shot.
Some experts argue he made those plans prematurely.
It was a bit of a misstep. They got the cart before the horse, because usually you discuss this in the FDA Advisory Committee, then the CDC Advisory Committee, and then you decide on a timeline when you're going to implement the new recommendations.
A White House spokesperson said Friday's vote was an important step forward, adding, "We stand ready to provide booster shots to eligible Americans once the process concludes at the end of next week." Members of the scientific community are also divided over a third dose. 2 senior FDA officials who plan to step down said a booster shot is not needed for the general public at this time, citing insufficient evidence. Their conclusion was part of an article published in the medical journal The Lancet. But a study in the New England Journal of Medicine that analyzed booster shot data for more than 1.1 million Israeli residents over 60 found a 10-fold reduction in severe illness compared to those with 2 doses.
We have good scientific information, but it should be clear to the public that as we try to translate that science into really sound public policy, there's not always just one right answer. There are numerous appropriate answers.
I think we should expect that at some point boosters are going to happen. So the question today is not really a booster yes or no, but rather, is now the right time for a booster?
But as the U.S. pushes ahead with boosters, some nations are still waiting for their first shot. More than 90 of the world's poorest countries won't reach a 60% vaccination rate until 2023.
We need to make sure that we do as much as possible to help immunize the world's population. New variants can crop up anywhere in the world and be transported here by someone riding an airplane. And so we need to be concerned for our own self-interest as well as humanitarian interest in curbing the pandemic around the globe.
A global fight calling for a global solution.
And Kathy joins me now live outside Pfizer headquarters in New York. Kathy, good morning. So as the debate over boosters continues, many families and schools now wondering when a vaccine will be available to children under the age of 12. What are you hearing about when we might expect to see those?
Hey, Willie, good morning to you as well. It's taking a bit longer to vaccinate children because the data is still being collected and scientists are still trying to figure out the correct dosage that would be safe and effective. Pfizer says it's on track to submitting its data to health officials at some point this month. Emergency use authorization could happen as soon as October. So if all goes as planned, specifically for 5 to 11-year-olds, vaccines could be rolled out through Pfizer late fall, early winter. Moderna is also following a similar path, but is just a few months behind Pfizer right now. And Willie, it is important to note, since so many kids are still unvaccinated, health officials are urging them to continue wearing those masks. Willie?
Yeah, especially as they're all back in school now as well, and those pharmaceutical companies taking extra time when there are children involved, obviously. Kathy, thanks so much. Appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.